All right, we're live.
All right, good afternoon. This is the Senate Health and Welfare Committee meeting. It is May 18th. And we are going to look at two proposals before us. One is JRH 6. I think we'll take that one up first for a vote. And Katie, you are here. Thank you for being here. So we have made no changes to we have not recommended changes to JRH 6 based on our testimony and information yesterday. So I'll open it up for discussion at this point. We did take a little vote, not a formal vote, an informal show of hands where we supported the draft that came to us. So is there any discussion further, committee? Go ahead, Ruth. Senator Hardy.
Thank you. I just had a question based on our conversation in the Senate Democratic Caucus today, and I can ask that now, or if you want to vote first, and then I can ask it, whichever you prefer, Madam Chair.
Well, it depends on what the question is.
Well, okay, so I guess I'll ask it, and then you can say if we want to discuss it. So especially for Josh and Senator Terenzini and Senator Cummings, who weren't there, we had a discussion about JRH 6. There were a number of questions, and one of the questions was regarding the fact that we had gotten some testimony on adding language or findings related to Abenaki Vermonters or Indigenous people who live in Vermont. And I explained that given the time and the lack of runway to make changes in bills and get them back and forth, that we did not make changes. And there was a question as to whether I would say in my floor report on the bill on behalf of the committee, if we committed to making changes next session. Was that what your understanding was based of that question, or just working on the issue? Or I'm looking to you, Madam Chair.
Right.
I want the committee to tell me what I should say.
So here's my suggestion. Let's see if there is a motion to vote on JRH 6, and then we'll take this up either as discussion or after we've completed our vote.
Okay.
Yeah, that's the next step, I think.
Okay.
But I'm glad you raised it. Katie, it's all set to go?
It is. I don't have to prepare anything since you're just approving it. So
Right. Okay. All right.
I would move to move JRH 6 to out of committee onto the Senate floor.
Okay.
As introduced from the House.
Okay. All right. Any discussion? So I will say, just in a bit in response to the questioning today about, or the concern about a lack of Indigenous folks in the resolution, at least the supporting documentation does talk about ethnic diversity, and which is important in our state. So I don't feel that we're shortchanging anything at this point. And I think that we can move ahead with the vote. Then we can talk about what it is we want to say on the floor about any promises. Okay. Any discussion? Senator Terenzini, please call the roll.
Yes, I will. Senator Terenzini votes yes. Senator Hooker, please.
Yes.
Senator Cummings.
Yes.
Senator Hardy.
Yes.
Senator Lyons.
Yes. Terrific.
5-0-0.
All right. So Senator Hardy will get that up to the floor, and it should be on the calendar for tomorrow. So we'll see how it goes. Katie, I do have one question for you, and it relates to the information that is or is not in the resolution relating to our our Abnaki population or our Native American population and ethnic groups from our state. As you look at that resolution, do you identify at least some reference to the group, or do you think it's totally lacking?
I'd have to look at each clause.
Yeah.
We talk about inequities based on race generally.
Yeah.
And the second whereas clause, we talk about systemic racism and social determinants of public health, all of which further adversely impact the health of people of color. The third whereas clause is specific to inequities among Black and Latino people in the United States. The fourth whereas clause talks about Black residents. Fifth whereas clause is, specific, or it's more general. It's race and ethnicity. And then we have a whereas clause about the incidence of COVID, and it's broken down into categories by Black Vermonters, Asian Vermonters, Hispanic Vermonters, and the rate for other races. So I'm assuming that's where Indigenous persons would be in that kind of broad category, other races. So I could keep going, but there are some places where the language is very specific to a particular group. There are other places where the language is a little bit more general. But of course, as was pointed out yesterday, there's no place where Indigenous populations are specifically called out in this resolution.
Okay, and then, so Senator Hardy, as you're going through for the floor presentation and looking at the, the information, the underlying supporting documentation, it might be helpful to see what is there. I'm going to do the same thing. But in terms of making a promise about what we may or may not do, I think we are certainly concerned about having our Abnaki population well represented as we correct inequities in the past and move forward. So either you or I can say something like that. I think it's not a matter of promising to do something, but we're certainly aware and understand the need for change, for doing something. Go ahead.
Okay, that sounds good. And I also will point out that we did make changes to H210 that included specific findings and language, both relating specifically to Indigenous and Native American and Abenaki populations, but also to broadly finding better terminology than using non-white. You know, Katie in particular worked hard to get that language right. And so I think that this committee has already shown a commitment to that. And so I guess I will underscore that as well. And then of course, the eugenics policy and practices apology that we passed last week is also part of that. We have done some things already this session, and there's certainly more work to do. And I think this
And
committee
we're aware
committed
of it.
to that.
Yeah, we're of course. So no, I think those are two good things to point
Okay.
out. I think in particular S210.
Yeah.
Yeah,
Okay.
Good.
Okay, great.
Perfect.
Thank you. I just wanted guidance so I don't say things that we don't all feel comfortable with.
We don't want to make promises because sometimes you can't keep them, but we are certainly aware of the things that we would like to do.
Great.
Yeah.
Thank you.
No, thank you. Okay. And whether I get up and say, whether I raise my hand to say anything, we'll see what transpires. I think just knowing that there may be another alternative proposal coming forward, we'll see. Katie, thank you so much for your work on this and taking the time from your family to be with us this afternoon. So I think we're good. I think we're all set. You can launch off to commence to go forth. All right. Take care. All right, we're good. So we're going to turn to S48. And Amran is here. Do we have S48 that we can look at, Amran? Or is it a big change that they've made? Why don't you just help us?
For the record, Amran Abergele, Legislative Counsel. You have two documents posted to your webpage. One of them is S48 as passed by the Senate, which went through this committee as well as through Senate Finance. And then you have a House proposal of amendment that is proposing two instances of amendment. So I would recommend going first to the House proposal because it is to add a section. And just as a reminder, this is S48, an act relating to Vermont's adoption of the Interstate Nurse Licensure Compact. So within the House proposal of amendment, the first instance of amendment is to add a new section 1A, Secretary of State Office of Professional Regulation report. On or before January 15th, 2024, the Office of Professional Regulation shall report to the House Committees on Healthcare and on Government Operations, and to the Senate Committees on Health and Welfare and on Government Operations concerning the implementation of 26 VSA Chapter 28, Subchapter 5, including, first, the number of compact licensees and single state licenses issued annually following the adoption of the Nurse Licensure Compact, and noting how many of those license fees were paid by a licensee and how many were paid by an employer or other entity on behalf of a licensee. 2, the resources necessary to implement the Nurse Licensure Compact. 3, the fiscal impact on the Vermont State Board of Nursing Special Fund. And 4, if the Office of Professional Regulation determines that the implementation of the Nurse Licensure Compact has resulted in a reduction of revenue available to the Vermont Board of Nursing, the office shall include in its report, A, a proposal to manage the reduction through administrative efficiencies, and B, if the office is not able to manage the reduction in revenue through administrative efficiencies, a proposal to address the reduction through an increase in the license fee for a compact multi-state license only. There is a second one. Would you like me to pause? The second instance of amendment is unrelated.
Go right through and then
okay.
we'll ask questions, I think.
Perfect.
Unless it gets really confusing, and we could just keep going.
I don't think it will be. So the second instance of amendment is removing a subdivision. So I'm going to point you to where that subdivision is in the as passed by Senate version.
Mhm.
You'll need to go all the way down to page 33, which has section 1648, administration of the Nurse Licensure Compact.
Let us
And if
get
you'll-
there.
Sure.
Okay, so it's page 33 and it's administration of, okay, so it's 1648. Got it?
Yes, so this is the section that concerns just how Vermont administers the compact.
Mhm.
And if you look down to subdivision A3, which is down on page 34, you'll see that the Senate version said that the Vermont State Board of Nursing shall have the power to 3, establish fees to offset the costs associated with administering this subchapter. So the second instance of amendment that is being proposed by the House is to remove subdivision 3 entirely and make subdivision 4 a subdivision 3.
And so then how is the loss of revenue compensated? Or
So
where does the money come for administering this chapter? I'm trying to understand that.
certainly. So there are a couple things to keep in mind when you are looking at this. One is the timing for the license renewal for LPNs and RNs, which are done every 2 years alternating. And the Office of Professional Regulation provided testimony in House Ways and Means as well as House Appropriations concerning how concerning whether it's possible at this point to estimate what the potential reduction in revenue is going to be, as there are so many variables. And you'll see if you go back through the testimony materials, OPR did provide testimony that this was a cost they could absorb for the first fiscal year or two while they determine what the revenue loss is. And that is why the report requirement that was added, and you'll see this report requirement was amended a bit when it went through the money committees, so that the money committees can see what the revenue reduction is, and is asking the Office of Professional Regulation to come back with a proposal for how those how that reduction in revenue is going to be addressed moving forward. There was also a discussion of sorry, I lost my train of thought. I saw that Nolan Langwell just entered and he might be helpful on some of the money questions. So let me take a moment and think. There was another point I wanted to make about a consideration that was thought of, which is completely escaped my mind at this moment.
I'm late.
Okay, so Nolan, what we're talking about here, because it might be helpful, the House
Oh.
proposal of amendment on the nurse licensure compact bill, and they took out language that allows for the Vermont State Board of Nursing shall have the power to, and what they took out was establish fees to offset the costs associated with administering the subchapter.
Yes, I believe that would come from, I'll let Ameren answer. She's got her hand up.
Yeah, let's go
No.
come from administrative efficiencies, right?
I just remembered what my other thought was. So one of the considerations that was given is that presently the license fee structure for nurses is done through the Office of Professional Regulation within Section 1577 of Title 26. And there was a concern about having a fee structure outside of the structure that is already within statute. And so that was one of the reasons for removing that section, so that any change in fees goes through the normal process for fee license changes for nurses.
Okay, that makes
That's what I was gonna say.
eminent sense. Very good. All right.
Madam
Nolan.
Chair,
Okay, go ahead. Go ahead.
I was
Nolan.
just going to say, because ultimately, the legislature sets the fees by approving the fees, right? So
Right.
that also would conflict with legislative authority to set fees. So it makes sense to me that they took that out.
And Ways and Means does not like giving away its power. The legislative.
Absolutely.
Well, but I don't think finance wants to either.
Agreed.
No. Okay, that's helpful. So that part makes a lot of sense. And then the first part that we looked at is the report in 2024. Any questions on that, committee?
I just have one quick question. And this is for Senator Terenzini. Does this make you feel a little bit better to have this report in there?
Senator Hardy, I'm fine with it. Yes.
Yeah, because it sort of gets to the concern that you had. So I thought.
Yes. Thank you for asking. I think this bill is very important to all Vermonters, and I want to see this thing advance. So whatever we need to do.
You know, it takes an elephant 22 months. And that's just about what this bill has had. So, hallelujah. Okay. Any questions or concerns about the proposal as it's come back to us from the House? The further proposal of amendment on S48. Okay. Then I think it just went through third reading, so it might pop up on our calendar. It might be something that we could do tomorrow or after our first adjournment. Is there a motion? Senator Hooker, do you have a motion?
Sure.
Okay,
Well, I will move that we vote out the S-48, the nurse compact bill.
And support,
as-
the,
and
that you
support
vote to
changes
support
from the
the,
House.
the,
Madam
No.
Chair, I don't think you have the bill to vote on.
Right.
no, that's true. We don't.
Oh.
Same thing we did yesterday with JRH 6. So
Mhm.
let's just get a show of hands. How many of you would like to support this? Yeah, raise your hand and say aye. Yes. Okay. So I think we're going to have to just meet briefly tomorrow or as soon as it is on our calendar. And my suggestion is this. If you could get to our session, if it's on the calendar tonight, if you can get to our 10 o'clock session 10 minutes early, can everyone do that?
Well, Madam Chair, we have a meeting tomorrow, first thing with judiciary
At
anyway.
8:30.
Maybe we could do it at the very end of that meeting.
That's a good idea. Let's do that. Good suggestion. So we're meeting at 8:30 tomorrow morning with judiciary. So right at the end of that, actually, I had thought about that the other day and I'm glad you brought it up. So this is good. And we'll vote.
Okay,
So there's a motion to be made, Senator Hooker, and Senator Terenzini, you will be ready to call the roll. Perfect. Senator Cummings, anything?
No. Will we have possession of the bill tomorrow?
If it's on the calendar, then we
Yeah, but
will.
all we have to do is concur.
Yes, that's all. We have to concur. I
Do
just
we
want to
have
know.
to vote to concur?
Well, we always have.
Do we meet in the corner?
That's what we're gonna do tomorrow morning. We're gonna meet in the corner. We're gonna meet in the
But didn't
corner
we just do that here?
after the
because-
bill comes over from the House. We
It may
can't.
not go to committee. It may just go.
Yeah,
to floor,
Yeah, it
and
goes
you
on
can-
the calendar. The
Yeah,
vote's on the
so why
calendar.
can't you just, unless they change it, why can't you just stand up and say we've concurred?
I can. I'm just gonna make sure that we do that. Vote and concurrence and agreement after it comes over to us, because you never know, it might change. We were told today that we have to wait for those things, so we're gonna wait.
Madam Chair, will you stand up or do you want me to? Because I reported the bill the
You're-
first time.
I'm fine with having you do that.
Okay,
Yeah, no, that'd be great, as long
No,
as
I
you're
should be ready.
comfortable.
yeah, I'm fine.
Just have to explain those two proposals of amendment and we're good.
All right, I may not be here because I'm
That's
still
okay.
scheduling committees of conference.
We don't, look at Ann, we don't give votes anyway. We just say that majority of the committee concurs. That's
Okay.
fine. Okay, now that we're thoroughly mixed up. Any further things? Nolan, thanks for showing up. Confusing us totally.
That's my job.
And so Nellie, we can go off YouTube again